A second person in the United States has now tested positive for the Ebola virus. Texas health officials said preliminary results were positive for a healthcare worker who provided hospital care for Thomas Eric Duncan, the Ebola patient who died last week. If the diagnosis is confirmed, it would be the first known case of the disease being contracted or transmitted in the United States.
While this is obviously bad news, it is not news that should bring about panic.
A statement posted on the Texas Department of State Health Services website said confirmatory testing will be conducted by the Centers for Disease Control and Prevention in Atlanta. Officials said the healthcare worker reported a low-grade fever Friday night and was isolated and referred for testing.
This healthcare worker had been under the self-monitoring regimen prescribed by the CDC and based on involvement in caring for the patient, Thomas Eric Duncan, during his care that started on September 28th. Now, individuals who are being monitored are required to take their temperatures twice daily, and as a result of that process, the caregiver notified the hospital of imminent arrival and was immediately admitted to the hospital's isolation room.
Preliminary test results were received late Saturday. Hospital and state health officials did not identify the healthcare worker. They have interviewed the patient and are identifying any contacts or potential exposures. Kelly Daschle, Associated Press.